Hey everyone, it's Matthew Zachary, and if you've been following my work since the Cancer Mavericks, then listen up, because my next big thing is here, and it's called Walk It Off, Men Don't Talk About Cancer. And it's the first podcast documentary series where men with cancer talk about, everything they're not supposed to talk about. Sex, shame, rage, silence, caregiving, vulnerability. It's raw, it's honest, it's long overdue, and it's everything you'd expect from me. The trailer just dropped. So subscribe today and get ready to binge all 3 episodes when the series premieres on September 11th. It's personal, it's powerful, and it's time. To learn more and to have a listen, visit walkitoffpod.com. That's walkitoffpod.com, or just search for Walk It Off, Men Don't Talk About Cancer wherever you get your podcasts.
I'm as mad as hell, and I'm not going to take this anymore!
Hello, friends. Welcome back. My guest today, returning champion Dr. Jamie Lee Wells. By trade, she is a board-certified pediatrician. She is a former adjunct professor of medicine at Drexel University School of Biomedical Engineering. She's a U.S. ambassador in healthcare to the Global Blockchain Business Council. And she's the director of the Research Science Institute, a prestigious international summer research program for high school students. And last but not least, she's now an author. And she's here to talk about her book, A Clinical Lens on Pediatric Engineering, Pioneering Science and Technology for Cutting-Edge Patient Care. Lots of syllables, lots of nerd stuff going on today, but she is the advocate's advocate. She is the nerd's nerd, and she is the unicorn's unicorn. It's hard to quantify what you're about to experience, but ladies and gentlemen, Jamie Wells. Oh, Jamie Wells.
I know.
You're back.
I'm a vibe.
You are a vibe. I mean, I just remember our last show. Like, it was like endless awesome.
Yes.
So don't disappoint me today.
No, just make sure we're recording.
But you haven't changed. No, we're recording.
Okay.
Yeah. And you're loud, too. You can talk up.
Because remember the first one we did? That was amazing.
And we broke it?
And
yeah.
I think I'm going to say you.
It was my fault.
Didn't.
I forgot. No, I'm staring at the thing now.
Okay,
it works. Everything's recording.
We're in it.
If it doesn't work, it's God's fault.
Yeah. Well, then we just have to do another one.
Yeah. Oh, woe was us.
I know, right? Because I think between the two of us, we could talk forever.
I mean, look, I've done probably close to 2,000 shows since 2007.
Oh, my goodness.
And I remember very few of them in this vein. It's hard to figure out who the hell you are because everything is fucking awesome. And there's no like one little off the shelf, Jamie is this for you.
I love that because I always say people try to put you in a box and that just drives me bananas.
No, you're like in some kind of like some Mobius strip.
Okay.
You know what that is?
A superhero?
No.
Oh.
That's Morbius. No, he's bad.
Right, Morbius. That scared me a little, that one.
What, then I knew it? Oh, you watched Morbius?
I mean,
why?
A few years back. I don't remember
like the worst thing ever.
Really?
Yeah. DC Comics, like that's the death knell for them was Morbius. Maybe Venom 3. We lost the entire audience. They're gone now. Everyone's gone. How the hell? My God, how are you? It's been 3 years?
No, really?
Yeah. 2022, I think, was when I first had you on the show, and it was post-pandemic.
I remember holding your Time cover? The poster board?
Yeah,
That was another. This is the third building I've been in to come and do a podcast,
yes,
I believe.
that is true.
Or fourth, maybe. I
keep
don't know.
metamorphosizing.
I know, right?
Know. What have you been up to? We're going to get to your book.
Okay.
Which is like the big surprise for me today. You have a book? All right, great. I'm going to scrap everything I put together for you.
Stop. Everything has chapters. I've practiced medicine for years and then I shifted.
Well, you were like a Drexel for an eternity, right?
I was there for a few years. They started the nation's first pediatric engineering degree program. So I was an adjunct professor there.
That sounds very I don't know, very, what's that movie, Metropolis from 1926? It's like pediatric engineering.
Oh.
You're making children.
You know, it's interesting. I said initially when I was asked to come up with regard to that, I said pediatric engineering, people will think engineering babies, but that's actually not.
That's what I thought.
Right. And I totally get it. But it's more looking at, if you think about every single thing in medicine that's designed to take care of a patient, whether it's by a physician, nurse, anyone, it's biomedically engineered, from the MRI machine to gene therapies to the surgical tools used, through the tubing, every piece of equipment, every vaccinations, anything that was designed
I'm sorry,
to help.
what? What's that word?
Vaccination.
I'm not familiar with that. Is that a social construct? Have we discussed this, Earl?
No. Well, I think we did discuss vaccinations, but think about literally everything used to care for a patient. That would be made by biomedical engineers, from the nipple in the bottle for an infant formula bottle or breastfeeding bottle. There's physicists who design the rate of flow. That's why the hole is a certain size so that a baby doesn't aspirate.
Right.
Implantable devices, prosthetics, immunotherapy, you name it, everything interesting, exciting, every advance, things that have failed patients, et cetera, are under the realm of biomedical engineering, or things that have had to be made better to factor in the end user. It all falls in that realm. So historically in medicine, everything has been designed for the 70-kilogram adult male, which they've always kind of felt just make it smaller for a child. But as you're fully aware, whether baby's an infant, premature infant at that, toddler, later childhood, preteen, adolescent, or young adult, they have grossly different needs. Their immune systems are different even as the child develops, from when they're 3 years old to 13 years old.
How long did it take mankind to realize this?
It took quite a while, and it really was the status quo in medicine. Just it's an issue of scale, and we know it's way more complicated than that. So it's not unusual for medical policy, health policies to be a little more reactive than proactive. So the exciting thing is I think we're really in a dawning era of pediatric engineering, in that we're utilizing. So what it really means is, instead of retrofitting things to just fit children, because there's, as a result of that stance, there's such a lag in pediatric innovation compared to the adult sphere in the medical realm. But now you got me with the Metropolis, because I'm like, what was I saying? But that's okay. I'll bring it back to. So the exciting era that we're in is utilizing a pediatric lens in design. So recognizing that children have different immunity, all their organ systems are different, all of their cognitive function is different. A child at 13 months can't give the same kind of informed consent someone at 13 years can. So really think about it from a biopsychosocial perspective.
Biopsychosocial. Now you're just putting words together.
Right. I'm using big words to just, well, they're really a mesh of two words. So biology. So fundamentally, they're different and evolving. And pediatric patients are really heterogeneous, because you're fully aware that, a 16-year-old has more autonomy. They have greater cognitive benefits or maturation, really, than a 16-month-old. So it's really important that you understand psychological differences. Their social dynamics are different. Less than 18, you have to get your parental consent or guardian consent for treatment, whereas if you're 25, you don't, unless very rare examples in terms of incapacitation. But in terms of younger childhood, it's always important to get assent from them, even if they're not in a position to consent to treatment. You have to think about the long-term ramifications of care in pediatrics.
Wait, let me put my capitalist hat on for a second.
Yeah.
Because none of this matters unless it makes money, right?
Oh, so it's so funny that you would say that, because one of the things that is addressed in the book, because there are a lot of...
You just teased the book again. Fine,
yes,
we'll get to the book.
We'll get to the book. One of the things has been, and to your point, and I love that you have the advocacy experience as well, to recognize that historically companies would think there's not a high return on investment, because things like rare disease, which I know you know a ton of, disproportionately impacts children. But despite the fact that rare disease affects tens of millions of people, one disease may affect 300. A different rare disease may affect 10,000.
Yep.
So if a company is considering making a product or making a therapeutic, they're going to think of, should we invest in this disease that affects 300 people, or should we invest in this disease that, like breast cancer, that affects 1 in 8 women. And I would argue that there's a wonderful story. They actually did, progeria is an advanced aging disease.
Yes.
Did you
I'm
see
familiar
that?
with that, yeah.
So progeria...
Wait, I'm an 1980s reference for that too.
Oh, really?
There used to be a show in the 80s called That's Incredible.
Why is that familiar to me?
It was like Fran Tarkenton and John Davidson, and it was like a variety show, but they told like incredible stories. And I don't know why this rents space in my brain 40 years later, but they did a story about this child with progeria who looked 80, but was like 6 months old. And that's my takeaway from what that disease meant to me when I was like maybe 10 years old.
Well, so sadly, there hasn't been a lot of investment in progeria because it does affect a couple hundred children worldwide. It is an advanced aging disease. So basically what happens is everything ages, all of the vasculature. So those with that disease don't have a longer life expectancy because they die in adolescence or young adulthood of coronary artery, they have heart attacks. They're at high risk of heart attacks, strokes, and the like. And so again, to your point with regard to the business perspective, I'm in medicine, so I'm kind of give excellence to everybody and, let's figure that out, kind of later. But it actually took two parents who were physicians to change their entire trajectory. There was a story about it. They did the story of their son's life on HBO, a documentary a few years back. There was nothing. There was no identification of the gene for progeria. There were no therapies for progeria. They were two doctors. One changed her course, and they started an organization. And within a year or so, within a very short period of time, they identified the gene that caused progeria. They, in the course of their son's lifetime, came up with a few therapies. There's still no cure for it, but in the span of how many years you were aware of this, there really was no advancement because there weren't dedicated resources to that. And I would argue that we can't afford to have a myopic view that it's population number or sample size number that should really determine whether we put resources at something, because some of the things they're discovering is on aging, and the topic of aging impacts 100% of the population. So I think sometimes it's funding in research is very imperfect in a lot of ways. It's a long-term game in certain arenas. You know how complicated it can be. But with respect to rare disease, this is an issue with a lot of things in that arena. Fortunately, FDA and the like has done some workarounds with regard to improving incentives. There's humanitarian use devices. There are a lot of public partnerships that are rising. In the realm of pediatrics, there's ShipMD as a strategic framework trying to, in addition to ShipMD, and as I said, Drexel's program started the first educating future biomedical engineers on pediatric engineering, Children's National Children's Hospital.
Did they ever find I guess I'll call it a common thread amongst multiple small rare disease communities where one treatment can help 4 of them or 5 of them?
Well, what's interesting, I can't speak specifically to that, but I can say one of the uses of AI right now is in trying to help with drug repurposing. So drug repurposing is a big trend right now because it takes some 20 years for a drug to get on the market. It's got high failure rates with R&D, it's a high cost as a result of that, getting patents and things. So by the time a drug goes through or a therapeutic goes through that patent phase and that R&D, research and development phase, it may be only a couple of years that it's on the market. And unfortunately, investing in these things is so important for humanity and advancing humanity in science. But one of the reasons that the drug repurposing trend has really become a major one is the fact that if you can find a drug that has been approved for safety, you don't have to lose 20 years in investment. You know already that it's safe and doesn't do harm per se, depending upon the dosage used. And so you can start ahead of the game in terms of applying it elsewhere. I remember at Hopkins speaking to a scientist who there was something in the lab with regard to mebendazole. Mebendazole is a common medication used in children for pinworms. It's something that I've never even seen a side effect, not to say there isn't. There's
Sounds like
always
a word that should be associated with children, pinworms.
Pinworms, yes.
My son eats dirt, so that makes sense to me.
Well, in children, it's given a dose, and then if they don't go away, then maybe they'll give a second dose, and it's not some crazy high dosage, but it was by accident that it was found in a lab, I believe it was at Hopkins, where they saw that it had an effect on brain tumors that were in I don't know if it was with mice or something. I'm vaguely remembering the story that they found that it did shrink the tumors with regard to that. So then they started researching that. But right now, AI is being used. AI is only as good as the data that you put into it. And with tons and tons of data, AI has a lot of promise with regard to going through that data to find those themes that you're talking about, those commonalities.
Well, I had that on our list of things to talk about. Is AI Skynet or is AI our savior?
Everything is... I'm not one to jump on the everything's a panacea. You have to have some more nuance with regard to that. In pediatrics, we found one of the chapters in the book Dr. Steve Bloomer did.
There's that book again.
I'm sorry.
We'll get to it. Jesus. No, I'm kidding.
Talks about how AI is in its infancy in the realm of pediatric radiology because using adult data has not been successful in pediatric radiology. They have found that if they eliminate the first 2 years of patient data, then for less than 2 years old, then they've had some greater accuracy. So the acknowledgement that it hasn't been used so much in peds, and that we just need to acquire better data is really at the forefront, and coalitions have started. So I think there's great promise of AI in peds, but there's great promise in AI in everything. But like any technology, if you don't consider the human and the human factors and the end user or primary stakeholders, I've seen the greatest piece of technology sit on a shelf or worse yet, do physical harm.
All right. So speaking of AI.
Yes.
I've adapted my show recently to have a lightning round at the end about AI and you. But just for fun, I fed you into AI.
Oh, geez. What did
and
it
I
do
asked
for me?
it a couple of things, and I don't normally prepare like this because everything's extemporaneous, but it asked me to ask you this question.
Oh, geez.
You wear too many hats. Physician, policy nerd, bioethicist, educator, blockchain ambassador, author. Why? And which one matters most? Can you rank them?
Oh, geez.
Thank you, ChatGPT. It said you wear too many hats.
I love that we started the conversation about too many hats. I look at that as my superhero strength, is that being dynamic shouldn't be a negative AI. It should be considered a positive, being agile. I think our world requires it, especially today. The time to be just a this or just a that, I think is long gone. And I don't think it serves you. I believe knowledge is cumulative, and there's no, every single thing that I've done personally, professionally has benefited me in what my main goal is. So if you ask me, my main goal is to make an environment better than I found it as best I can and help the most amount of people. And
How Hippocratic of you.
So everything in that realm, it looks different. It could look as doing a book. It could look as being an educator. It can look as being a practicing physician. So it can look differently, but I think I'm really mission driven. And as long as that's at the core, I'm happy to podcast it or scream it to the mountaintops. I also think that the greatest lost innovation happens at the interdisciplinary knowledge gaps. Whatever field you're in, the further you get into it, if you're a lawyer, if you're a doctor, if you're an artist, if that's all you're around, every one of us, the longer and longer we get into our careers, the more echo chamber centric you become. And I think that's a real lost opportunity. So I don't think there's any more important. The people I love and care about are the most important, but I feel blessed. I've been a caregiver. I have been there for precious moments for loved ones. I have practiced medicine, and I feel incredibly honored for my patients to have given me that privileged position when I was in practice and teaching the next generation. So I find everything, I really have a real curiosity to learn constantly. And I think you live life once, and I want to consume all of the new knowledge that I can and help in any arena that my expertise helps facilitate that.
Those are some good syllables. You are the unicorn's unicorn, and we'll be back after the break because, this show might go 3 hours. All right.
I'm into it.
We'll be right back.
I like unicorns, the unicorn.
Done.
That's done. That's my new, the unicorn's the unicorn. I'm got to text myself.
Want to sleep like a pro? There's a reason 80% of NFL players choose Sleep Number smart beds. These game-changing beds automatically contour to your head, neck, and shoulders, delivering MVP-level comfort all night long. Perfect for post-workout recovery, you can adjust the firmness whenever you need, while the climate-cool technology keeps you up to 15 degrees cooler. Plus, it's like having a sleep coach. The bed learns your patterns and provides personalized insights for better sleep. Why choose a Sleep Number smart bed? So you can choose your ideal comfort on either side. The only bed that lets you make each side firmer or softer whenever you like. Your Sleep Number setting. And now, it's the Sleep Number 4th of July sale. Save over $600 on the Sleep Number P5 King Smart Bed, the lowest price of the season. Limited time, exclusively at a Sleep Number store near you. See store or sleepnumber.com for details.
Ryan Reynolds here from Mint Mobile. With the price of just about everything going up, we thought we'd bring our prices down. So to help us, we brought in a reverse auctioneer, which is apparently a thing.
Mint Mobile Unlimited Premium Wireless. How to get 30, 30, bit to get 30, bit to get 20, 20, 20, bit to get 20, 20, bit to get 15, 15, 15, 15, just $15 a month? Sold! Give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. New customer offer for first 3 months only. Speed slow after 35 gigabytes if network's busy. Taxes and fees extra. See mintmobile.com.
Finally, the book, which you sprung on me today and ruined everything. A Clinical Lens on Pediatric Engineering. This is a wonky book. But that makes sense because you're an awesome wonky person. First of all, who's the reader?
Everybody.
Okay. You hear that, listeners? You're the readers.
See, that's my don't wear one hat.
Yeah.
This book really, I really intended it. I think I say everybody, but that's just because I'm so passionate about it. It really is a cumulative life work, and I think there's so much important information in there. But I mean, anybody aspiring to the medical field, a student in the medical field, whether it's in medical school, public health, bioengineering, or seasoned physician, leader in healthcare, CEOs of biotech, to heads of health systems, to honestly anybody who's ever had an idea and wants to understand how you get that idea from your head and to an actual patient, what the barriers are, what the pain points are. And I do think that this case example of it in the pediatric realm can be extrapolated to the adult realm. Whereas the reverse has been the case, I think that seeing the peds story in how it compares, contrasts to the adult medical story, I think really can inform on that front as well. So I do think for anybody who's in a position to take action, to help patients, to advance getting therapeutics to people who've been ignored or are most vulnerable. There are very unique things in the geriatric world that you need and should be framed differently. There are a lot of unique populations. And so I think really, I joke, but in all seriousness, I do think it could be beneficial to anyone who wants to have an understanding about how things work. And it really does take you on an exciting journey of where we've been, where we are, and where we are headed in the realm of medical innovation.
Has this been like living inside you for so many years now and you're just waiting to hatch the egg?
Well, you know,
why now?
I have like a ton of books in my brain, but this is particularly special. It's always been a bucket list item to want to do a book in my life, but this happened, I think, at the time that it was intended to. My father had 4 cancers in 9 years, as I referenced earlier, being a caregiver, which was very eye-opening from the patient. You know, I've been on the doctor practicing side, I've been on the patient side, and, you know, patient safety and excellence for every single patient is a real passion. And when you see a lot of the things from that perspective, which makes you an advocate, which is why you and I bond so much, because to me, families can deal with an ominous diagnosis. It's the unnecessary, avoidable suffering that becomes intolerable. So when Springer Nature came to me to do this book, my dad was so excited about it, and it was a light in a very, very dark time. Unfortunately, he passed away during the process of doing this book, but it is particularly special to me because my grandfather was an engineer and lived with us. We all participated in his home care. My father took me on rounds and was a family practitioner for many years. His patients loved him. He did home visits. We believe in that kind of medicine. It's that continuity of care that leads to greater outcomes. So it really has been a cumulative life story that brought me to this point, and my practice, advocacy, all of the things, all of the hats that AI has some element of disdain for.
Too many hats.
Which is why it totally drives me nuts when they talk about like branding. You have to pick one thing.
Right.
My one thing is that I'm not one thing. There you go. That's my brand.
That's
the
your
unicorns.
T-shirt.
Exactly.
I'm making that up for you. You're getting T-shirts.
I'm so over it of you can't be bright and be fun. You can't be serious and have a silly side. You know, if you can be any of these things, which you should be able to go in and out of those, life is vibrant. And you have to celebrate the good, and you can also do productive, meaningful things in the process.
I have a question about the, let's stop treating kids like small drunk adults and built them for kids, kind of like that. Have you ever witnessed or been aware of, or maybe it's already happened, where a kid suggests something that then becomes something?
Well, it's so funny that you mentioned that. I'm just remembering when I was in practice, going in the room and teens would be on their phone and diagnosing themselves and things like that. Could it be fetus in fetu, which is where like it's a growth that is a twin that does it's,
right.
Just these whack diagnoses out of whack. I've seen wonderful things with former patients and honestly, I led a program at MIT with scholars and students in teaching in different ways. And honestly, you learn from them all the time. They've always been there to facilitate tech advances that would take me 10 years to figure out, like not medical technology, but like all of the computer and communication tools and things that we have. There are a lot of ways, if you listen to hear how they want to be cared for, how they want to be treated. I just think that if you use an empathetic lens with everything and anything, even in scenarios that are not positive, and you understand where someone comes from, you can work together to come up with the best solution. So there have been so many experiences, and it's hard to narrow, honestly.
Well, I have an anecdote.
I'd love to hear it.
I'm sort of making this up from memory.
Okay.
But it had to do with pediatric cancer with like mouth sores.
Okay.
And they kept giving kids like, I don't know, Ambisol or like adult crap. And it's disgusting and kids don't want that. And like, let's make it bubblegum flavored. Okay. They would never think to make it bubblegum flavored. What's wrong with you? Need a kid to tell you this is gross, make it bubblegum flavored, and then it would help being flavored for kids.
But that would be, I would say that's even in the realm of pediatric engineering, because you have a lot of medications, for example, for young children have to be made in liquid form because they can't swallow a pill. So they get reconstituted from powder. And I would say, they haven't, amoxicillin, when you're in residency in pediatrics, they'll give you the run-of-the-mill ones. And
amoxicillin is like the most delicious thing.
Exactly. As
an adult, I want the liquid.
So I'll never forget, when we were in residency, they put out a couple of the most common liquid medications for the residents to taste so that they have an understanding, like you're saying, with regard to what will breed compliance or not, because it's great if you prescribe the best medication for the thing, but if nobody takes it,
right,
or
what
is the point? So I couldn't participate because I have severe drug allergies to a couple antibiotics. So
you're a catch.
Right. I mean, it's awesome. And strawberries.
Yeah.
So no strawberries and no, certain antibiotics. But I just remember everybody's like, pass the amoxicillin. And the one that they've yet to figure out that people I think they make it tolerable but not enjoyable, and it's due to the chemical makeup. But prednisolone, the steroid, is a tough one to make taste palatable. But again, with every plus, every reaction, you have an equal and opposite reaction. But they're doing a lot of things in terms of making things more enjoyable and palatable. There's a whole, I know you're going to say with regard to the book, but I can't help it. There's an entire chapter about the built environment, about how that improves therapeutic benefit and healing. Because think about how stressful pediatric healthcare facilities.
There's a term for that, by the way. It used to be called experiential marketing.
Yes. Oh, I know what you're saying.
In the 1990s. And that's when, this happened earlier, like when they realized kids want to be in environments where they feel safe. It seemed more naturally instinctive for humans to know that kids shouldn't be treated in sterile environments and there should be plushies and cartoons on the wall. And we never really thought about that as like, this is intentional experiential marketing to make it easier and less stressful for the kids.
That's interesting.
Yeah.
So because I just remember when I was a child going to your pediatrician's office, if they had a cartoon on the wall, that was major difference.
Yeah.
And that was pretty much the extent. That's pretty much the extent of it. So there's a wonderful chapter by a team from Ewing Cole who goes through, first of all, there are things that you don't realize that add so much stress, like where parking is, wayfinding through the facility when you go to get a treatment or a therapy, it is extremely stressful. Even if, you're the toughest person out there. Adolescents don't want to be with the little kids. The little kids don't, have different needs. So there's a wonderful chapter in terms of the evolution of how children's spaces are designed, how they convert and require flexibility with the advancing technology, where you have to convert, like think about COVID, you have to convert a hospital room to an isolation unit, to an OR, to, whatever. So there is dedication for that, especially with those who have differing abilities to make things more accessible. You have to be able to function and also not induce additional stress that's unnecessary, because that weakens your immune system. It doesn't help you get better. So 100% agree with you.
All right, shifting gears for a sec. I'm on the board of the Binghamton Alumni University Mentorship Program.
Fantastic.
And I love meeting the eager young minds of tomorrow to be either enchanted or disappointed. You are on the Yale Alumni Health Network.
Yes.
Do you get to interact with the eager young minds of tomorrow?
I get to interact with them in so many arenas. Like one funny thing, one of my former patients, he had posted a photo. This isn't related to the Alumni Health Network, but I can come back to that, but it's top of mind. He's taken photos of us throughout the years. He's particularly tall. I'm a little under tall.
Under tall.
My legal height's 5'2", but I've probably been measured 5'2"
my daughter's
twice.
5'1.5". She would love you. Okay.
See, if you're tall, if you're measured first thing in the morning, you're tallest by half an inch. So if my hair is air dry curly and it's first thing in the morning, I could maybe make it to 5'2", but I'm probably close to the 5'1.5". So I actually have a former patient of mine who years ago, he's quite taller than I am. Years ago, we would take funny pictures or just real life pictures throughout the years, and he put one up on his Facebook many years ago saying, my doctor's cooler than your doctor. Then all of these folks came out in the comments, that's my doctor, that's Dr. Wells, whatever. And then through the years, and even up till last week, he just sent me, that photo has gone viral over a decade.
Are you serious?
It's been in board panda lists for tall and whatever.
Oh my goodness.
And we actually were going to try and recreate it in the last week. So we're totally going to recreate it, because he's now studying to be a paramedic and just epic. And I have to say, to your point, in so many ways, going back to that, see how I looped the theme back to the many hats?
I see what you did there.
I'm a lifer. It is such a symbiotic relationship to be a pediatrician with the families. When I taught at the program at MIT, the Research Science Institute, when I taught at the students, future biomedical engineers at Drexel School of Biomed, in a host of other arenas, students I have met through the Alumni Health Network, I am a huge proponent of sharing what you know, and you can learn from anyone, and whether it's the next generation or former generations. I always advocate I don't like the silos that we design in life of having just fresh graduates or just 10 years out or just this, kind of thing. No, I think we've shown, grandparents who are around their grandchildren live longer. And I think everybody has value to contribute. And so I really believe in mixing the generations. And like I do with interdisciplinary knowledge gaps, I just think that you learn, if you have an outlook of wanting to continuously learn, and being around young folks really does inspire and open your mind in a different way. And I have not found a negativity in terms of their voice. I just met with a family of one of my former students I can't believe it, who we met when she was in high school, and now she's almost graduating college and on her trajectory. And it's just so exciting. And I think you can help each other in so many different ways, and they keep you with that wide-eyed view of the world. So I am a huge advocate of listening to hear young people and really engaging, because I think it's really beneficial, and they're wonderful. And I think they get a bad rap. I mean, this is the pediatrician in me. I don't know, in the media and things, they get such a bad rap, but they have wonderful vision. They're hardworking.
I think it's really just anecdotal stories of Gen Z being this or millennials being that.
Yes, and I'm over that.
Yeah. My greatest success story in terms of...
Hashtag over it.
Do we still do hashtags?
I don't know.
I think hashtags are out.
Shoot, did I age myself? I'm ageless.
I don't know. Everything's some kind of like TikTok something at this point,
That's
some dance
true.
move or whatever.
That's true.
No, I have a beautiful claim to fame story. My very first formal intern at Stupid Cancer is now I believe she's the chief of staff for New York State Attorney General Tish James.
Oh, wow.
So I knew her when, and what a great story.
Yeah,
and,
I've been saying recently to this that they're astounding what they're doing, and I say, don't forget me when you need an intern.
I know, right? Reverse engineer all that stuff.
Like, I've seen some of my former patients getting married and going off to graduate school and practicing their profession, and it's just so, how did I get to this stage where I ran into another professor who told me, just wait till your patients' children have children.
Oh my goodness.
And I said, wow.
There were so many weddings and marriages and children from the Stupid Cancer universe.
Oh, amazing.
So many. Yeah.
That's wonderful.
It was just it's still a wonderful ecosystem. I left 7 years ago at this point now. It's pretty crazy, but the legacy continues.
Right. That shows the reverberating impact that you've had, and it has, and that successful thing. I think if people have an active alumni and continue in it, it shows that it had real value and meaning. And the word value, going back to our original business thing.
Oh, God.
I resent the word value in the business realm.
It's jargon. It's a cat poster kind of thing. It's words.
I define it so many ways and so differently, of course.
Right. No, it's like when I was first asked, how'd you like to be a cancer advocate? I said, what the fuck is a cancer advocate? And they kind of said, look, we're going to help you make the next you have a less shitty time. I was like, all right, done. Nice and easy. What a simple answer.
You know what I just thought of, like you said, with the term pediatric engineering cancer advocate? If you think about the term, you think it's advocating for cancer.
Yeah.
But it's totally advocating for cancer's end and germination.
All right. So from the author's tongue, a clinical lens on pediatric engineering, what's the one thing you hope listeners gain the most from by reading it?
Well, I really gathered the greatest minds who are experts in these different topics throughout it. And I think the greatest thing to take away probably is how you really can make an impact in the world. And with regard to medicine, there's so much innovation that has happened and can happen and can have a really lasting impact to future generations. So focusing on it and prioritizing it is important. And also finding those people who can advocate in that realm is important. And eliminate and listen to other people in different realms within, so that you can find your greatest ideas. So I really, it's hard to come up with one thing, obviously, when you've been working on something for a while and you're so passionate about it, but it really covers so many different things. I have teams from the new Yale Center for Immersive Technologies in pediatrics to those who are addressing regenerative medicine for the most lethal diseases in the very young, to eye cancer and liquid biopsy, artificial intelligence. I mean, it really covers everything. So if you're interested in new technologies and the like, I really, again, I underscore the greatest thing is you have to have a patient-centered lens, know who your patient is, to really come up with a successful intervention. Otherwise, and who your primary stakeholders are. I think that's one of the biggest things, as opposed to the opposite. Because I would argue, and I'm not going to get so into it, but I would argue that one of the most negatively disruptive technologies was the forced implementation of the electronic health record that was pitched as a panacea, but what was delivered was just a glorified billing platform that did meaningful patient harm.
Are you starting a whole new show?
No, but I could go on a tear for that. And part of the reason is it didn't factor in the end user. And it's not that I'm against it. The original what was delivered was not interoperable by design. So I think that we really are in an exciting time with regard to recognizing that the pediatric patient is unique. That, as I talked about, there are so many different unique populations, and you have to take the evidence-based information but apply it from a real world perspective. where they're using adjunct of real world evidence with clinical trial, because pediatric clinical trials have a high failure rate in children for a host of reasons. So I really do think it's an exciting time in the realm of development in medical and scientific technology and advancement.
All right, you ready for the lightning round?
Okay.
More AI.
Okay.
So I decided instead of like just traditional AI, well, like what should I do? I asked AI, all of my guests, I asked AI, if you were a Netflix series, what 3 pop culture cult figures would best represent your energy and ethos?
Oh.
You'll never guess, so I just tell no one's ever guessed.
Them. Oh, okay. Because I would say like Sesame Street would be one of them. I would say like
no, AI is telling me
okay.
the answer.
Okay, go ahead.
And no one has ever guessed what AI says.
Okay,
but you will smile, and people actually want this printout.
Okay.
You are a combination of Lisa Simpson.
I don't know The Simpsons. You'll have to.
All right.
Okay.
Forgiven. But
Okay.
you're a brainiac outsider who never stops asking why not better, even when no one's listening. Ethically grounded, unapologetically nerdy, and has receipts.
What?
Yeah.
That is epic.
Yeah. You are Clarence Worley from True Romance.
I don't know who that is either.
All right. We're going to have a lesson post when the show ends.
Okay.
I'm taking you binge drinking in the 80s. All right. Because beneath the polish, there is someone who probably kicks convention in the shins and doesn't wait for permission. You speak fast, you move faster, and you always bet on yourself. And you're Agent Dana Scully from the X-Files.
Oh my goodness.
The scientist with a scalpel-sharp mind, constantly navigating male-dominated systems while demanding proof, accountability, and actual logic. Zero tolerance for pseudoscience.
Oh my god, this is freaking me out.
AI did a good job on you.
I think the psychic world is going to be in battle with AI because that is really.
So you're Lisa Simpson, Clarence Worley from True Romance, and Agent Dana Scully from X-Files.
Okay. Well, those you're going to have to tell me about, but the other words I really liked.
Yes, exactly. I don't even know how to outro you because you're so many things, but Dr. Jamie Wells is go to LinkedIn in the episode notes. But at this point now, the most important thing is you are a new author and your baby. Tell us about the book. No, I'm kidding. I know what the book is. We've been talking about it. A Clinical Lens on Pediatric Engineering, available now wherever books are sold. Link to Amazon in the show notes. I love you. I adore you. I'm so happy to have you back on the show.
Thank you so much. I'm so happy to be here. You're the pro. You're the expert. And I mean, it's just limitless, anything that you put your hands on and do.
Flattery gets you everywhere. All right, folks. See you next time.
Out of Patience with Matthew Zachary is a production of Matthew Zachary Worldwide. The executive producer is Matthew Zachary. It is mixed and edited by Kyle Moore. If you like the show, ratings and reviews are always welcome wherever you get your podcasts. If you have guest suggestions or would like to learn more about sponsorship opportunities, email podcast@matthewzachary.com. For more information about Matthew Zachary and Matthew Zachary Worldwide, visit matthewzachary.com.